let's take a look at this case. This is another piece of skeletal muscle. I think you'll realize that instantly, even though it's not normal, by virtue of the fact that you see fibers that have clear striations and nuclei arranged at the periphery. These fibers are a lot thinner than normal, if you remember from the previous normal set. In addition, there is some fat between the fibers. This is once again a denervation type of atrophy. Why might it be like this? Well, let's take a look at the spinal cord. Notice in the upper right here, this is a spinal cord. This cleft represents the anterior or ventral portion of the spinal cord. And so the gray matter is generally oriented along here, and these would be the regions of the anterior horn cells. So take a very close look at this area here, and we'll blow it up. Well, you can see that there are some inflammatory changes. They are chiefly perivascular, but they also involve the gray matter of the spinal cord itself. There's an inflammatory process going on here. And although chiefly you can see a reaction of glial cells as part of this inflammatory process, please note that there are occasional neurons, like here and here, which are being involved also. These anterior horn cells, the motor neuron cells controlling the muscle we just saw, are being destroyed. They are being destroyed by an inflammatory process. The chief and most common inflammatory process involving motor neurons of the anterior or ventral horns is the poliovirus. This is poliomyelitis of the anterior horn of the spinal cord, which is causing a secondary denervation type of atrophy in the corresponding skeletal muscles, in which you see thinning of the fibers and some deposition of fat. Thank you very much.